Hello everyone, it's Seth from Upman Integration. Welcome to another video. Thank you for taking the time out of your day to be here. Today I'm going to be talking about box breathing. Now, box breathing is a very simple exercise. Anyone of any age can use it as long as you can teach it to them. They can practice it. It's very safe for everyone to use. I won't be talking so much about the history of box breathing or where it particularly, the history of where it comes from, because where it comes from is from the yogic practice or the yogic sciences of pranayama. And pranayama, basically when you translate it from Sanskrit, means energy and control, but in relation to the breathing exercise, it's just basically a controlled breathing routine or cycle that you go through. And the reason or the purpose behind doing this exercise is to get the mind or the body into a different state of being or different state of awareness and feeling, because a lot of the people who come to me who are seeking some form of therapy, either through talking or through Reiki or using some other modality, is experiencing some form of stress or anxiety or depression. They could be processing some form of trauma or grief, and this can be a really powerful tool that one can use in their own time to help bring themselves back to themselves in the moment, because Lord knows that when we're experiencing some form of distress, either in the mind or the body, our natural instinct is to react to that. And sometimes the reaction can be so overwhelming or so overpowering on ourselves that we feel like we don't have control over that anymore. And so this can be a really beautiful way for you to regain control over yourself, so that way you can feel more centered and more grounded within yourself. And so this exercise is very, very simple. It doesn't require too much brain power to, process it or understand it. But I've actually taken the liberty of taking the time to draw this, exercise in the form of a visual representation of what it looks like. And you can pause this video for as long as you need to make an exact diagram of this. But I've simply drawn it as so. And so, because it's called box breathing, I felt it would be important to draw it in the shape of a box. Apologies if my lines aren't very straight. But you can see, obviously, there's a box there, and around the outside, I've drawn the number 5. And so the number 5 represents the time frame of the cycles of how the breathing works. And you also notice that I've gone in and out and hold and hold. And so this visual representation of the box breathing exercise is as it looks. So you start with normal breathing, but you take a 5-second breath in, and then you hold the breath in for 5 seconds, and then you breathe out. So you completely decompress your lungs out over 5 seconds. And then once you've completely decompressed your lungs of all air, then you hold the breath out for 5 seconds. Now, there's a little bit of misinformation when it comes to this exercise, because a lot of people who've come to me, have practiced this before, or they've been taught this, but they've missed a few key elements, regarding, how it's actually supposed to be done. Because the most common one is that when they're taking the breath in, they're just doing it very gently and very normally. And the whole point of this exercise is to, really get you into a different state of awareness and different state of being. And so, to really embody this practice and do it properly, you have to do the breaths, you have to basically overcompensate for it. You have to do it to the extreme level. And it's really forcing the air in and then holding it and then really forcing the air out. Because if you're just doing just a normal breath in and a normal breath out, it's not going to elevate you into that new state of awareness or that new state of being. So it's really important that you do the breathing part of this exercise properly, because it's going to have a number of benefits for you. And another important aspect regarding this exercise is making sure you're doing the breathing through the right, orifice, if you will, because if you do mouth breathing, that's going to actually inflame or worsen the experience that you're having in terms of processing your grief or anything like that. Because the way that this exercise is supposed to be done is you're supposed to do the breathing in through your nose and then out through your mouth. Because if you do the breathing in through your mouth, you're doing what's called, you're engaging your sympathetic nervous system. And so your sympathetic nervous system is responsible for taking in large amounts of oxygen or large amounts of air and preparing the mind and the body to run away from something. So this is actually going to naturally engage that limbic region of your brain, or the amygdala region of your brain, which is going to trigger the fight or flight response. And so if you do this exercise with breathing in and out through the mouth, those anxious feelings or those depression feelings or anything that is relevant to those sensations or thoughts that are making you feel really down and quite trapped within yourself, it's going to amplify that and make it worse. So you really want to concentrate on breathing in and out, or in through the nose and out through the mouth. By breathing in through the nose, you're going to be engaging what's called your parasympathetic nervous system. And by activating the parasympathetic nervous system within your body, you're engaging your body's natural repair mechanism. And it's also responsible for rest, relaxation, recovery, everything to do with that, anything in that nature. So by breathing in through the nose and out through the mouth, you have this ability to activate your body's natural repair mechanism, and you disengage that region of the brain that is possibly getting a little bit triggered by anything that you're processing at the moment. You could be having, like I said, anxiety or anything like that coming up for you. So this is a really powerful tool to help you process that. So we'll do the exercise together now. Please take some time out, either for the next 5 minutes or so, to really get through this. I've done in this example 5 seconds, but if you have respiratory issues or anything like that, you have trouble breathing through your nose, do this in a way that is comfortable for you. Please do this exercise in a space where you're comfortable and you're not going to be engaging in anything. So please don't do this while you're driving or operating any heavy machinery or anything like that, because you want to do this in a safe space. If you're just walking down the street, or on the side of the road, or not on the side of the road like a highway or anything like that, like on the footpath or something like that, you're more than welcome to do this while you're walking, or connecting with nature or anything like that. Just doing it in a mindful, and I suppose in a sacred setting as well. But with regards to the 5 seconds, I just set that as a benchmark. That's normally how it's used in that time frame. But if you feel like you need it to be longer, or you feel like you need it to be shorter, then you can do so. I would kind of keep it at a minimum of 3 or 4 seconds at the absolute I suppose smallest example of that. If you want to do say 7 or 8 seconds, you're more than welcome to do that. But this isn't something that you do once in a cycle. You do this several times, and for this example, I've done 5 cycles or 5 intervals, but you can do this as many times as you feel the need to, because sometimes you can get through 5 cycles and it's not enough. Maybe you need 6, or maybe you need 10 or 12. It's really just about you feeling into it and going, okay, what is it that I need, in this moment? How many times do I need to do this in order to feel, better within myself? And, this exercise isn't to bypass or suppress or move feelings or thoughts away from yourself because you don't want to deal with it, because that's avoidance in whatever scenario that's playing out. This is just really to help you manage what's happening for you in that moment. But anyway, we'll jump into the exercise. I'll stop myself here and then move into the next section of the video. So please stay tuned and we'll talk more. Okay, bye. Alrighty, thank you so much for joining me for this next part of the breathing exercise. So we're going to be doing it in 5-second intervals, and we're going to be doing it in 5 cycles. If you feel that you need to do more, then you're more than welcome to do more. But this recording is just going to be here to give you some guidance and some instruction. I would invite you to take a moment just to clear out your respiratory system, or clear out your airways. Take some time to blow out your nose. If you have anything, in your throat, or you need to just take a quick drink or anything like that, please just take the time just to remedy that, and then we'll jump into the exercise. Okay, so now that you've done that, you've taken some time, we're going to start by just becoming aware of the breath passing in and out of the body, ensuring that we're breathing in through the nose and out through the mouth, or just for the moment, breathing in and out through the nose. And then we're going to do just a slight breath out, and then taking a big breath in through the nose. Really fill the lungs up through 1, 2, 3, 4, 5, and hold the breath. 2, 3, 4, 5. And completely decompress your lungs. 2, 3, 4, 5. And in, 2, 3, 4, 5. And hold. 2, 3, 4, 5. And out. 2, 3, 4, 5. And hold. 2, 3, 4, 5. And in. 2, 3, 4, 5. And hold. 2, 3, 4, 5. And out, all the way out. 2, 3, 4, 5. And hold. 2, 3, 4, 5. And all the way in. 2, 3, 4, 5. And hold. 2, 3, 4, 5. And out. 2, 3, 4, 5. And hold. 2, 3, 4, 5. And that's 5 cycles. Just coming back to the breath now, just returning to normal breath. In through the nose, out through the mouth. Or in through the nose and out through the nose. Just paying attention to the body. Paying attention to what's happening to the mind. If there's any emotions that need to come up, then just allow them to come up. And just sitting in that space. If you feel like you need to do more, then please feel free to do more. But just, if you need to take some time to sit in that space after this few intervals of breathing, then just sit there. Just be patient with yourself. Just give some time to yourself. And just relax. And then when you're ready, you can return to whatever it is that you were doing. I hope you all have a wonderful day. And thank you so much for joining me. Goodbye.